Hi, my name is Patty Thetford-Thompson, and I'm here in the office of Dr. Corey King, my new best friend. I came in with vertigo. I started with vertigo in January. Wasn't blessed enough to find him until April. I have Hashimoto's thyroiditis, and I've known that for years. I've done the regular treatments. Being a nutritionist for 15 years, I have access to a lot of healthcare professionals and treatment plans, supplements, diets, everything that you know. And I tried from January to April to fix myself. I was unable to do that. I did something I've never done before. I got on the internet and he popped up. I think it was a God thing because I don't know how else I would have found him. And I live in Newport Beach. He was right here in Tustin, so how convenient is that? Came in, did the initial eval, told me a lot of things I already know, some things I was doing, some things I was being lax on, but got me kick-started back on some dietary things that I should have been doing. But more importantly, he did the evaluation. I was so impressed of what he knew and how he knew how to implement it. So now here we are in September, and I've been well for months and slacking even on my treatments because I feel so well. Not realizing what the Hashimoto's was involving in my cerebellum, I was pretty devastated that I was not able to function at the capacity that I was, and I'm feeling fabulous, doing all the right things, and I would recommend his program to anyone.
Well, thank you, Mrs. Thompson. Share briefly about the diet and how that impacts the thyroid gland.
The gluten sensitivity test I did, and I was gluten and celiac sensitive, which just supported what he had already told me. The gluten, I finally got it, how that works with the thyroid, how the antibodies attack my own thyroid gland and creates the destruction. That's, none of us with thyroid problems want any more destruction on our thyroid. So realizing how it affects it so severely, I'm very careful. And I was hesitant, like a lot of my clients, that taking the gluten out of the diet was going to be such a huge thing. But it was less difficult than I thought. I wasn't eating a lot of gluten when I came in, but the little bit that I was consuming was enough to really affect me.
And share with what you know now how the thyroid impacts the brain.
The thyroid, there's thyroid receptors all over our body for every organ and system. And the brain, with the neurotransmitters and inflammation in the body, how the inflammation creates more havoc all over your body, but in your brain, it will affect everything.
That's early degeneration.
Absolutely.
What we're seeing in your
Yeah.
father.
And my dad is struggling with Parkinson's right now, and I have a son who is 20 years younger than I am, who is struggling with vertigo right now, and thyroid issues, and a lot of the same thing, depression and fatigue, and a lot of other things. So it's a generational thing. So if I can short circuit this for him, and now my grandchildren also, we need to be careful because they're prime candidates for all of this also.
So if there's one thing you could share with thyroid disorders and dizziness patients, what would it be?
Evaluated to find out exactly how to fine-tune the things that you need to do so that you can be the best you can be.
Okay, and how do they figure out what's going on with it neurologically?
Neurologically, Dr. Corey King did a lot of eye, hand, motor skill evaluation. Some of it seemed kind of primary, but it nailed it. It did the trick. And he's able to retest, which I was impressed with. So it wasn't just an initial consult, that you can retest to find out what's working, what's not working, what you need more of, less of.
Very good. Well, we're very proud of you, Mrs. Thompson. You've done a great job, and you're sticking to what we've asked you to do. And we're always working to improve other things. But thank you very much.
Thank you.